Alright, this is my third attempt at IV piggyback. So first thing I'm going to do is I'm going to take my medication administration record and compare it to my physician's orders. And what I'm looking for here is to make sure that they match in patient name, medication, dose, time, and route. So I've got Mr. John Doe. He will be receiving 2 milligrams of ceftriaxone diluted in 100 milliliters of normal saline to receive it at 1 o'clock or 1300 via IV piggyback. I'm also going to make sure that he has checked for any allergies, and if he does have allergies, make sure that they do not conflict with the drug that I would be administering. Next, I'm going to come over to my IV drug book and check to make sure that this is a safe dose. I can give up to 2 grams per day of ceftriaxone. Here I'm only giving 2 milligrams. Dilution can be diluted in a solution of up to 100 milliliters of normal saline, which is exactly what I have, is 100 milliliters of normal saline that it will be diluted into. I'm going to check compatibility, and for this particular patient, I know that he has D5W running in the room of primary. Make sure that it is compatible with D5W. I'm going to check rate of administration. For this patient, for this drug, we want a single dose needs to be given over 30 minutes. And for 30 minutes, that is 200 milliliters per hour. Or for our case, since we're doing it by gravity, it will be 33 drops per minute. I'm also going to check precautions. And the main thing for this particular drug is that you do not want to administer it with calcium, any other calcium containing IV solution. Once I have done this, I can go ahead and go to my nurse's station, collect my equipment. I'm going to perform hand hygiene, get my equipment. I'm going to make sure that I have my drug that's pre-mixed, my IV, secondary IV, my secondary tubing, my alcohol swab, and of course my label. I'm also going to check this drug to make sure that it is in date, which it is. I'm going to fill out my label with the drug, the amount of the drug in it, today's date, the expiration date on the drug I have here, the patient's name, room number, start time, today's date, and my initials. I'm going to take that label, which I have already filled out, apply it to the drug. You can see that I have filled out all the information needed. I've got everything that I need to enter the patient's room. I'm going to perform hand hygiene. Enter the patient's room. I'm going to introduce myself. First thing I'm going to do is check 2 identifiers. One identifier will be his wristband. Second identifier he will give me verbally. I'm going to ask for his name and date of birth, which I should have on my MAR. And it should match with what's on my MAR. So this should be the 3rd time that I've checked to make sure that I have the correct medication for the right patient. One I did when I compared it with the physician's orders. The 2nd time I checked it whenever I was looking at my IV drug book, and now this is the 3rd time I've checked it in the patient's room. Tell the patient that he will be receiving ceftriaxone, which is an antibiotic to hopefully take care of whatever infection that he has at the time. Tell him that he will be receiving it via the site that, via the IV site that he already has. So I will not have to stick him again. I can inspect the site, make sure there's no redness, swelling, edema. Ask him if he has any allergies, and if he does, make sure that those allergies do not conflict with ceftriaxone. I'm going to take my primary, put it below the level of the arm, make sure that the IV line is still patent, see that I get blood return, which I do. And at this time I can go ahead and set up my secondary. I personally prefer to prime the tubing in the patient's room. Get all the bubbles out of the line. Got my alcohol pad that I brought to the patient's room. I'm going to use the hub closest to my primary infusion bag. Scrub it for 15 seconds. Cap off my secondary. Alright, unclamp secondary tubing. Now I'm going to set the rate using my primary line. Might take me just a second. We'll come over here. Starting right now. And stop. All right. Once I've done this, I can reassess the site, make sure my patient is comfortable, leave for 30 minutes. After 30 minutes, I come back, reassess the site, make sure my patient's comfortable. I can clamp my secondary. Throw it away. Raise my primary. Set the rate back to what it was originally, or per physician's orders. Once again, ask my patient if there's anything he needs. Wash my hands and leave the room. And document.